the supermarket workers, the bus drivers who keep vital wheels of the country turning.
Channel 4 News has learned that the scientific advisers to the government on COVID-19 have warned ministers there are now 3 separate epidemics across the country, in hospitals, in care homes and in the general population. Yet only the number of deaths in hospitals are currently being updated every day by the UK government. Our health and social care correspondent Victoria MacDonald reports.
Across the board, the general population, care homes and hospitals. Not one overall picture. Instead, we have now learned 3 separate epidemics. As the Easter weekend comes to an end, there are signs that people have been following the social distancing rules and that infection rates may be flattening off. The science appears to show that one person is capable of transmitting COVID-19 to 3 others, except when you have measures like social distancing. So in the UK, they believe that has fallen from one person to less than one other, except in care homes and hospitals. Now those same experts say that there is a data blind spot. They don't know what that transmission rate is. As more care homes report multiple deaths and increasing numbers of patients are being infected while in hospital, the scientists are looking at how they can measure this, if not geographically, at least nationally. At today's Downing Street press conference, the Chief Medical Officer, Professor Chris Whitty, confirmed the sheer scale of it.
In the last 24 hours, there have been 92 care homes where an outbreak has been detected.
The experts trying to model the care home and hospital transmission rates will report to the Scientific Advisory Group for Emergencies, or SAGE, who in turn advise ministers.
And what we've got to do, though, is try and look at how we prioritise things like care services, where every single person who's in a care service is in a high-risk category. And we need testing so that we know exactly who's COVID-19 positive and we can respond appropriately.
This is not just about personal protective equipment or PPE, but inevitably it will form part of the discussion over cross-infection. This doctor, Ariel Eno, showed us pictures of the masks she's used in her hospital's A&E over the past weeks, from the flimsy to the full shield.
Over the last week, more often than not, we have had FFP3 masks when I've started my shift, but often towards the end of the day. So when the night staff come on, we're normally running low or out of them completely. I guess an important thing to say is that in my department, as with many other departments, there's not a clear division between beds. So there might be curtains drawn across or even the curtains open. So there might be someone receiving high flow oxygen in one of the cubicles, but then the cubicle opposite and the corridor outside that cubicle, there'll be people walking just either with surgical face masks or sometimes no face mask at all.
More PPE did go to hospitals over the weekend, including much needed gowns, but care homes are still reporting supply shortages.
I think what we now want to hear from government is absolute assurances about the supplies going forward, not just that they've got the stocks at national level, but that they've got a system in place which makes sure that whether you're a care home, whether you're a GP practice or a community nurse or a big hospital, you are going to get the supplies of personal protective equipment that you and your staff need.
And there is the same message for testing. In the past few hours, it's been confirmed that 13 residents from the Stanley Park care home in County Durham have died of coronavirus. The staff are all said to have had PPE, but it adds to the evidence that the infection can spread further and faster in these homes than in the general population.
Victoria MacDonald. Now, staff looking after the sick and elderly in care homes have been praised by the Chief Medical Officer, Professor Chris Whitty. He said they were doing a very difficult job for their residents. A care home in Nottinghamshire is reeling from the news that 9 of its residents have died over the past few days. Staff describing the situation as leaving